Hi, I'm Olivia Slaughter, certified prosthetist orthotist with Real Life Prosthetics, and this video is about upgrading prosthesis. It's different from having a device that needs replacement. Um, Insurance is the biggest driving force with upgrading prosthetic devices. They have very clear guidelines on when you can upgrade. Um, the number one reason why someone could upgrade to a better device or one that's more fitted for their needs is if they increase in functional level. Insurance define these as K levels, and it's a category of how much you interact with the community, how often you come across different terrains, if you go grocery shopping independently, if you drive your car independently, things like that could bump you to new functional or new K levels. There's 4 functional categories you can be classified as. If you increase a functional level, that could unlock different devices, particularly with prosthetic feet. You could have upgraded prosthetic feet, the higher K level you get, and microprocessor knees are available with higher K levels as well. The next area in which you could upgrade a device is if the device is older than 3 years. New technology comes out every year with prosthetics, but typically insurance wants to see that a device has been used for 3 years. That's typically how long manufacturer warranties are for. And then you could upgrade to new devices as they come out every 3 years. Last thing, to upgrade a device would be an instance of catastrophic failure where your activity of daily living is more than the device could handle. Say you're doing a lot of heavy weight carrying or things like that, where the prosthetic foot is appropriate for your weight category, but you've just been kind of feeding it up because you're a really active user. That could justify a more meaty or heavy-duty device. Thanks for listening. Give us a call or comment on this video if you have any questions. We have 5 offices across Maryland and Delaware. We'd be happy to serve you. Thanks.